Good afternoon. On behalf of Shelby County Mayor Lee Harris and City of Memphis Mayor Jim Strickland, welcome to the Joint COVID Task Force news briefing. I have two announcements that I'd like to share with you today. Starting today, La Prensa Latino is going to partner with the Shelby County Health Department in providing translation of our weekly briefings beginning today. They will be available on the Shelby County Health Department's website and also on the La Prensa Latino website. The second announcement that I have, the Shelby County Emergency Management and Homeland Security Agency has partnered with the Shelby County Health Department, the Shelby County Fire Department, Memphis Fire Department, and the cities of Arlington, Bartlett, Collierville, Germantown, Lakeland, and Millington to provide masks to the children of Shelby County. The Kids Mask Up campaign will provide masks to our most precious cargo, our children. We need to do all we can to protect them during this pandemic. Most masks are too large for our little ones' faces. The masks that we're providing will fit most kids' faces. The Center for Disease Control and Prevention recommends children 2 and up wear a mask when in public to protect them from the virus. So on Saturday, September 26th, from 11 a.m. to 3 p.m., kids' masks will be available at numerous locations throughout the county. For your local mask distribution site, please visit the Emergency Management and Homeland Security website at www.staysafeshelby.us and the Shelby County Government website at www.shelbycountytn.gov. Thank you.
Thank you, Director Jones. I encourage everyone to participate in the mask pickup for children. It's critical that we get masks to individuals who need them, and particularly masks that fit appropriately. So we're excited to partner with Director Jones and her team to get masks out to children. I also want to welcome you to this afternoon. We're going to take a little bit of a different route on our Thursday joint press conference. As you know, we typically give a lot of data on Thursdays, but we have had a lot of questions relative to Health Directive 12, so we want to make sure that we dedicate enough time for questions and answers today. So I'll give a brief update on data, and then Dr. Randolph will join me, and he'll give some updates on the Health Directive, and then we'll open it up to specific questions. So as of this morning, we have 30,837 cases. That's an increase of 147 since yesterday. So we are back down to where we were prior to Labor Day, where we have some fluctuations in numbers, but they're really hovering in the low 100s, which is positive. Unfortunately, we do have over 400 deaths that we've experienced within Shelby County. I want to speak specifically to some gating criteria, and these are gating criteria that we've looked at not only in Shelby County, but across the United States from the very beginning of the pandemic. And it is the context of all 4 of those gating criteria that influence our drafting of the Health Directive and our movement forward for either county-wide interventions or more laser-focused interventions. So clearly, we always look at the scope of the pandemic locally. What do our numbers look like? What is our reproductive rate? What is our duplication rate? What are our numbers and our trends relative to communities around us? And what are those trends relative to our historic experience with the pandemic? So as we know, we had reached the majority of what we had identified as tripwires prior to Labor Day, with the exception of the 30% reduction. I want to remind everyone that the tripwires are not a checklist. They are a list of metrics that we consider relative to the other items that I'm going to cover. But we were really at that point before Labor Day. Dr. Randolph and I, as well as with input from others, really decided that we needed to wait and see the impact of Labor Day. We were at a pivotal point. We did not want to experience in Shelby County what we did in July, so that we needed to wait out at least 2 weeks past Labor Day to see the impact of Labor Day. But that we also needed to experience and look at the experience of schools reopening and determining if that was going to impact increases in numbers and increases in potential community transmission. And within schools, specifically getting back to sports and the impact of sports on our numbers. The second gating criteria that we've looked at from the beginning is testing capacity. We have significant testing capacity in Shelby County. That's a reflection of our partnerships locally with our safety net providers, our healthcare providers, and now the health department has additional capacity for testing as well. While we have testing capacity and anyone can access testing regardless of insurance status and really regardless of whether they're symptomatic or not, we are still underutilizing testing capacity. So it's important to recognize we have capacity. We need more people to continue to get tested. The third area we look at is hospital capacity, and we do know that we have sufficient hospital capacity in Shelby County. Most hospitals have really been running in the green, occasionally in the yellow, but that is a reflection of other things not limited to COVID, including traumas. In addition to that, we also look at morgue capacity, and we have sufficient morgue capacity within Shelby County and have actually funded and supported increased capacity with the West Tennessee Regional Forensic Center. The other area that we look at, which the health department has the most intimate knowledge of, has to do with our public health capacity. We do know at the very beginning of the pandemic, and as we began to see surges and receive many, up to sometimes 400 or 500 reports per day, there was significant strain on the public health system. We have been able to build our capacity significantly through CARES Act dollars. That is by hiring new staff to augment our existing staff. Initially, 141 positions, but then ultimately adding 70 additional positions. While all of those are not filled, many of them are, which allows us to do our case investigations in a timely manner, work on contact tracing in a very timely manner, and to do enforcement and follow-up, which is critical. We do many things in public health. I think everyone is acutely aware of contact tracing, but we have a responsibility to do assessment, which is the data that we provide, the case investigations, cluster and outbreak investigations, and contact tracing as a component of that. But we also have a responsibility to do enforcement of the health directive and assure that businesses are in compliance with that health directive. So in moving forward with health directive number 12, all of those things are taken into consideration, and we believe at the current time, the decisions that we've made, particularly to open limited service restaurants and to put significant restrictions on those facilities, that we have sufficient capacity to monitor, to see the impact of that incremental change, and to intervene if there is an influence on the scope of our pandemic relative to that particular change. We will continue to monitor very closely into the first week of October, and based on our findings at that time, we may also make some additional changes. But I really want to highlight where we need to focus moving forward. We are at a point, particularly because we have significant data locally, and we have added some data tools locally to help us pinpoint where outbreaks are occurring. We have to focus on some of the behaviors that each of us individually need to take. So continuing to mask, continuing to social distance, continuing to really do good hand washing on a frequent basis, and to avoid those activities in places where there's more likelihood of transmission. That includes really making decisions about whether or not you would go to a restaurant or a limited service restaurant, limiting your time there, and adhering to the restrictions that have been put forth. For individuals who have chronic illnesses or who are above the age of 55, you really need to make sound decisions about the activities that you'll participate, including the ones that I've listed, but also travel, when you spend time with family who does not live in your household, actually wearing a mask indoors, but also making sure that you spend time outside, and when possible, you allow some air to circulate through your home by opening windows. The other areas that we need to focus are on the case investigation and contact tracing. The lab turnaround time is about 1 to 3 days in Shelby County currently, so that when a case is reported to the health department, which is required by law, we have that case assigned and begin the investigation process that same day. However, what we're finding when we reach out to people, only about 50% of people are actually taking the call and responding. So we need each of you, particularly if you know you've been diagnosed with COVID, to really respond to the health department's call so that we can identify your contacts, support you in your isolation, and reduce transmission that way. Also with contact tracing, it's really important that employers, academic institutions, and schools report to the health department when they have cases, and that they begin to work with the health department immediately to contain that outbreak or to prevent an outbreak in their facility. Lastly, we do have some organizations within our county who are not adhering to the health directive, who may open after hours, who are not supporting social distancing, and who are not masking. So we have a very strong emphasis on enforcement. We want to work with businesses to come into compliance, but it's also important to recognize that if a business elects not to comply to the health directive, we will have no choice but to close that particular business. We do believe by being laser focused, we can contain the virus where we are currently. By monitoring the data, we can make additional changes that may be necessary to reduce transmission in our community. So again, want to acknowledge all the efforts of everyone across our county. Everyone has sacrificed in some way. Many of us have tried to partner to the best of our ability to reduce the impact overall on our community, but most importantly, to reduce deaths and suffering as a result of COVID transmission. So with that, I'm going to pause, turn it over to Dr. Randolph. He's going to speak specifically to the health directive, and then we'll open it up for questions.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County. Dr. Bruce Randolph, the health officer for Shelby County Health Department. And I just want to again reiterate some of the same things that Dr. Haushalter has mentioned and highlight some of the areas in the health directive that I really want to reemphasize and encourage everyone to adhere to. First, I would encourage each individual to obtain copies of the health directive, particularly if you are owner of an establishment, so that you would know exactly what are expected, what's permissible, what's allowable, because the enforcement that we will institute will be based on what's in the health directive. And so we strongly encourage that you know what the requirements are. As individuals, I encourage you to have copies of the health directive because we point out the important individual safety measures that you can do as an individual to keep yourself as safe as possible. Let's face it, the virus is here. It's going to be with us. We've made progress in the things that we've done so far. We want to continue to make progress. And the bottom line is that if you do right, you can do more. And so that's the emphasis. And doing right means wearing the mask, maintaining the 6 feet separation, and adhering to the other safety measures that we've outlined. One thing I want to just highlight about the limited service restaurants, some have asked why did we allow them to reopen. Our position is that if an establishment adheres to the safety measures that we are requiring of a full-service restaurant, that is, the bar area is closed, no sitting or standing or gathering at the bar, that everyone must be seated at a table ordering food in order to be served alcohol, Music is played at a level that doesn't require people to talk loud and yell, and there's no dancing indoors. These measures, the tables are separated 6 feet apart from each other. These type of safety measures, if applied by any establishment, whether you're full service or limited service restaurant, place the risk of getting the virus at the same level. So we feel that limited service restaurants are not inherently more risky than any other if all adhere to the same safety measures, and that's why all of these establishments listed are required to adhere to the same measures that we have. But I want to make something very clear, though. Enforcement will be very seriously pursued. One aspect of the health directive that I hope you have taken note of is that on page 16 of the health directive, it specifically states that violation of the safety measures outlined in the health directive may lead to termination of the Alcohol Beverage Commission license permits. And so we're partnering with ABC, and they're going to help us enforce this by, if indeed there's an establishment that is not adhering to the safety measures, and we close you, but not only will we close you, you may also lose your permit or your license for alcohol through the ABC. So we're very serious about this. It's an opportunity for everybody to move forward, but everybody got to do right so we can do more. With that, I think I'm going to stop so we can have ample time to answer any questions that you may have pertaining to the Health Directive number 12.
Stephanie Skurlock, WREG.
Yes, 2 questions. The first question is, you mentioned that you're going to be beefing up enforcement. Who will partner with you in beefing up enforcement? Because I believe I heard maybe the health director say earlier this week that there were some places, 200 people or so had gathered and they weren't wearing masks. Well, it appears, we haven't heard anything about any sanctions for that particular place. So who are you all partnering with to make sure the enforcement takes place besides ABC? And also, what is left to open when you talk about moving forward? Okay,
I will answer the first part, and then I will have Dr. Haushalter come. Well, if you notice that still adult entertainment venues are still closed, and also large parade festivals, fairs are closed unless we specifically give approval of the specific sites that these events will occur. The other thing is that we're hoping that, one, the establishments and the citizens will take it upon themselves to realize that, hey, if the enforcement, if people doesn't comply, it put the whole community, business community in general at risk, because if we get an increase in our numbers, then we would have to go backwards. We're also hoping that even law enforcement, Memphis Police Department, Shelby County Health Department, all would pitch in and be partner with us to make sure that people adhere to the health directive and do the right thing. I'll have Dr. Haushalter.
Thank you, Dr. Randolph. I just want to add to that. So the enforcement role is a role that the health department has at all times. Most people are used to our inspection of restaurants and so on and so forth. In addition to the contact tracers that we've added to our team, we've actually added a significant number of positions to focus on enforcement, and they have been doing enforcement for some time. And we do that two ways. One is proactively by doing surveillance in certain areas, certain communities, different times of the day, certain types of businesses. Then also reactively. So when we receive a complaint, and I'll talk about how to submit a complaint to us in a few minutes. When we receive a complaint, that is forwarded to the enforcement team. There is follow-up. Sometimes that follow-up is from Dr. Randolph. Sometimes it may be from me, maybe from David Sweater, it may be from a team member. Our first goal is to make sure that a business understands the health directive and what restrictions they're supposed to adhere to. Then we also, if need be, will take additional action, and that might be asking them to voluntarily close before we close them, or we may actually issue a closure. We will keep that facility closed until they come into compliance. As was noted earlier, we will partner with the ABC board to address people's liquor licenses, but we also partner closely with the Shelby County Sheriff's Office and the Memphis Police Department. We also partner with all of the municipalities, either with their codes enforcement or their law enforcement, and we've been doing that for some time. But we also have to rely heavily on the community, and that was what Dr. Randolph was referencing. It's important that as consumers, you exercise your consumer rights and assure that the businesses that you go to actually are adhering to the health directive. You also have the ability to submit a complaint to the health department. There are several ways that you can do that. One is to call 222-MASK, or you can reach out to the Mayor's Action Center, or you can send an email at Shelby TN Health. We have staff that work 7 days a week. They are out all hours of the day and night. I think there's a misperception that we are not out in the evenings or the weekends, but we actually are out. We have teams out every weekend well into the late hours. But we're really relying heavily on the public as well as others to get information to us so that we can really intervene quickly to reduce the likelihood of transmission.
Did you have a follow-up, Stephanie?
No, that's good. That answered my question. Thank you.
Sam Hardiman, Commercial Appeal.
Hi, my first question is for Dr. Haushalter. Dr. Haushalter, you said that the only tripwire that was not being met before Labor Day was the 30% reduction in cases. When in the past 2 months have we had a positivity rate on tests less than 10%? Could you point me to a time?
Yeah, I'd have to go back and look at the data. I think the main point that I was wanting to make is that the tripwires are not a checklist. There was never a communication from me or the health department that 100% of those tripwires had to be met in successive order. We have always said they're in context, and that the tripwires actually were designed to support me and Dr. Randolph in moving forward with policy decisions more quickly. I think early on when the tripwires were published, the media asked, was it an and or list? And I clearly said it was both. And so it is the context of all those 4 areas that I mentioned earlier that are important. So I may go back and not find exact date that we were below 11%, but we were fairly close. I think the other key takeaway is what Dr. Randolph said. The current restrictions that we had on limited service restaurants, we knew that if we applied the same restrictions that we did to full service restaurants, knowing that with the data that we currently have, we could not pinpoint outbreaks to full service restaurants after they open and adhere to the restrictions, that we could safely open them with the restrictions in place and monitor that very closely. Your next question, please.
Yes, ma'am. Could you explain the public health strategy behind removing occupancy limits at businesses?
So the occupancy limit was set initially really as a way to make it easy for the business owner to determine how many people could safely be in the space. This was not just the health department. This was in partnership with all of the Back to Business group. We had a lot of communication around percentage occupancy versus number in a building and so on. And where we landed initially was that business owners know what their occupancy limit is because of the fire code. And that typically they know very easily if they're supposed to have 100 people as their top limit or not. What we found is that was not really sufficient to help the business owner make decisions on social distancing. There became some confusion. Do we focus on percentage occupancy, number of occupancy, or social distancing? The public health strategy is social distancing. And so by alleviating that occupancy limit, we do allow them to focus more on the social distancing component, which is most critical. With some of the restaurants earlier, as they open back up, an example would be, clearly we said you can't have people standing at the bar, you can't have people in close proximity, but we did say, well, you could expand your table space as long as you were social distancing. So we really were trying to make the message cleaner so that business owners could make more sound decisions around social distancing.
Kendall Downing, WMC.
Good afternoon, everyone. I wanted to switch gears and ask a question about the setup for the drive-through flu shot clinics and the potential COVID vaccine. Could you update us on the discussions with that and where we are with respect to that in the county? And I have a follow-up if time allows. Thank you.
Sure. Good afternoon. So a few things. One is there are surveys that are in the field to see if people are likely to get the COVID vaccine or not. So that's important to get feedback from the community so that we can help design strategies based on that feedback. As far as planning, not just for drive-through flu vaccine, but also vaccine to be administered through the safety net providers and the health department, there is a planning group that's meeting to focus really on the tactical implementation of that. So we do anticipate that'll happen fairly quickly. The goal would be at testing sites, there's one line that's for testing and one line for flu vaccine. So I would hope that relatively quickly we'll be able to have that up and running. There are some places that have vaccine already, but I can tell you within the health department, we have not received our shipment yet. So as soon as there's a shipment that we've received and there's more vaccine in the community, we'll be able to get it out to the community. As far as the COVID vaccine, we will be flexible. Clearly, there's a lot happening at the national level. We have to be ready to mobilize as soon as vaccine is ready. We will start communications around, we've already started on flu vaccine and mentioning COVID vaccine, but we'll focus more on marketing once we have more information about when the vaccine is likely to be ready, what type of vaccine it is, in any particular, there's usually a list of items that you cover around vaccine, like who can't get it, who should get it, is it 2 vaccines, how far apart do they need to be? We'll start that messaging when that information is available to us. And your follow-up question, please?
Yes, ma'am. It's, obviously getting to be the fall. Through the start of this pandemic, we've been in the spring and in the summer when it was really easy to move things outside or be outside. How big of a concern is it for the health department that we're kind of getting into the months where you can't really host events outside, or having things outside might become prohibitive because of weather and temperatures? Thank you.
So it is a concern to us. We know as we get into colder months, people are more likely to be indoors. They're less likely to open windows, and so the air stagnates, and that increases the risk of transmission. We also know that if people are indoors, they're likely to be closer together, which also increases the transmission possibility. So we are concerned about that, but that's also why we're really asking people to consider the types of activities that they engage in. Who do they have visit? Who do they go visit? Do they have an opportunity to really open the windows and allow some air to circulate through? The addition that I would make to that, we are in the South. So there is a benefit here that we actually have nicer weather for a longer period of time than particularly northern cities. And so my hopes are that people will take advantage of beautiful fall weather and spend time outside. Thank you.
We are out of time. Are there any closing messages?
I really just want to remind people to go to Shelby TN Health, print off a copy of the health directive so that they have more information, and to really begin to think through in more detail what each of us individually and collectively can do to continue moving us in a positive direction. Thank you.
Thanks, everyone.